Welcome everyone to the first TCM Gynecology chat on Sunday afternoon. Each one of these will vary as time goes on. This week I decided to look at some of the questions or things that you had posted on the question that I asked you about the things you see the most common in your clinic. So I have those printed out in front of me. I'm going to go through some of these, answer these, basically just get you thinking like a TCM gynecologist, because that's the most important thing before you solve a problem is to know how to think about it. For those of you who are new, we had quite a bit of a swell in membership this week, so I want to introduce myself. My name is Michael Peluso. I'm a TCM gynecologist. I completed my TCM gynecology training under Bob Flaws through the Blue Poppy Institute. I'm also the staff acupuncture and Chinese medicine practitioner at CNY Fertility. That's Robert Kiltz's clinic in upstate New York. So I have a considerable amount of experience with a lot of these conditions. I also practiced gynecology exclusively for the last several years at my own private practice. And so I've seen most of these things, hundreds and even thousands of times. And so what I'll try to do, again, moving into the educational aspect of things, I want to get you thinking like a TCM gynecologist and really practicing TCM or Chinese medicine really, really well, because it applies universally. It's not just gynecology. Really, it's all of Chinese medicine. So looking at a couple of these first questions, it's actually going to give me a great opportunity to jump right into how we think. The first question was about heavy, painful, clotty menses, and then most often inability to conceive. So that's an infertility issue as well as a menstrual complaint. So what you need to do first and foremost is when you're questioning your patients, your fertility patients, make sure that you are inquiring about menstruation the way that we do in Chinese medicine. Very often, my fertility patients at the clinic, they'll tell me, I've had 5 IVFs. I've been trying to conceive naturally for years. I've had multiple IUIs and I can't seem to get pregnant. There's nothing wrong with me. Tubal patency is fine, no occult infections, uterus is in good shape, ovaries are functioning fine, and yet they can't seem to fall pregnant. They're well within childbearing years. Begin to ask them about the menstruation. How's your menstruation? If you ask it generically like that, they'll invariably say, it's fine. But then when you press a little bit, is it really heavy? Oh yeah, it's really, really super heavy for the first day. Or is it clotty? Oh yeah, I definitely get clots. Do you get huge clots? Do you get stringy clots? Do you get, you kind of go through that. Is it really painful? Yeah, it's super painful. What about premenstrual symptoms? Oh, my breasts are killing me. I get all sorts of pain. I get super moody. None of these things are considered problems by and large in a Western fertility clinic. Very often these are overlooked. I mean, unless they're causing serious, serious problems, this is where Chinese medicine begins to shine. I cannot tell you how many patients have had just some of these small things corrected. We're getting rid of the heavy clotting, alleviating a lot of the pain, helping to course the liver, rectify the qi, helping that coursing and discharging aspect of the liver. They fall pregnant within a cycle or two, and you haven't done anything necessarily physically or mechanically, but you've helped them manage their qi dynamic, and that's huge. So let's look at this first question, right? Heavy, painful, clotty menstruation. Okay, so heavy menstruation or profuse menstruation. Remember in some of the videos that I've talked about, there's really only 3 causes of pathological bleeding in Chinese medicine. And those come from a qi vacuity, not containing the blood, blood stasis, forcing the blood to move outside of its vessels, as well as heat. And that can be either replete heat or vacuity heat, pushing the blood outside of its normal pathways and vessels. So when a patient comes in and they say, I have very, very heavy periods, the beauty of this is you can begin to narrow it down. And what's nice about this is we know that of those 3, the blood stasis, it's always secondary to another disease mechanism. So now we're really narrowed down to 2, qi vacuity and heat. So that's fairly easy to tease out with regard to questioning through pulse, through tongue. You can begin to develop that pattern. So you'll be able to come to a conclusion about why they're bleeding heavily fairly quickly. The next one is painful menstruation, right? Tongjing. So there's the saying, the little quip or adage in Chinese medicine and gynecology, tong zi butong, butong zi tong. Where there's pain, there's no free flow. Where there's free flow, there is no pain. So if there's painful menstruation, we have to look at why. What causes free flow to be obstructed? We know a number of different things, right? It can be cold, it can be blood stasis, it can be liver depression, qi stagnation, it can be phlegm even. So we just look at these things that impede the free flow of qi and blood throughout the body, and those can create pain. So what you want to do in this particular case, if there's profuse menstruation and painful menstruation, you want to look for the most common denominator within that single patient and then treat that. And very often that's enough on its own. Sometimes you have to treat a little bit longer, sometimes you have to treat a little bit shorter, sometimes you have to increase dosage. But the key with anything in Chinese medicine, above all else, is making sure that you have the right diagnosis, which is why being a crackerjack diagnostician is critical. Master the pulse, master tongue diagnosis if you can. Really nail your inquiry. So you don't want to get lost in inquiry. You don't want to ask a billion questions. You want to use targeted questioning. The beauty of practicing gynecology is that we go right for the menstruation, because the menstruation is this beautiful insight into the functioning of your female patients. It gives you almost all of the information you need to then diagnose the overall health of the other zong organs and the fu organs as well, but primarily the zong organs. So I hope that that's clear. Is that clear to everybody watching? That makes sense to you, that you really want to make sure that you understand the disease mechanisms that would cause bleeding and the disease mechanisms that can typically cause pain. If you understand those two, you're going to tackle many of the menstrual complaints right off the bat. Okay, so let's take a look. I'm going to take some water here. Okay, again, there was another question about painful menstruation. We just covered that. Bacterial vaginosis and yeast infections. And this comes back to the thing that I harp on all the time. The Western biomedical disease, it's great to know. It's important for your chart. You want to write that down. But the first thing you have to do is recognize that in Chinese medicine, there is no such disease category. Bian Bing, no such thing as disease of bacterial vaginosis or yeast infection. So you have to reframe that. Okay, in traditional Chinese medical gynecology, there's a category of diseases called Dai Sha Bing, which are diseases below the belt or abnormal vaginal discharges that will typically cover the signs and symptoms that present in bacterial vaginosis or in yeast infections. So from there, you begin to explore, well, what are some of those Dai Sha Bing? There may be, we want to look at the different colors of vaginal discharge, the red, white, yellow, black. Then we can look at the consistency. Are they thin? Are they thick? Are they curdled? Those types of things begin to help you narrow your Chinese medical pattern that may be driving this. If there's vaginitis or things like that, you want to look, I guess you don't look in our field, but you would inquire about the vaginal meatus and the surrounding tissue to see if there's inflammation of any kind. And when I say inflammation, read redness, soreness, dryness, any type of patching or scaling. Traditionally, these things would have fallen under dermatology, but as Chinese medicine has become more westernized, they now fall under gynecology more so than they did in the distant past. So these are addressed by Chinese medicine. I personally don't see them as much as I used to in private practice because I work in a fertility clinic. These are usually typically handled through Western pharmaceutical drugs, so I don't have as much of a chance to treat them. But when I did use a lot of yin care. I found that to be a great product if you got the dilutions proper, as far as an external wash or an internal application, in addition to internal application of Chinese medicinal substances, herbal formulas. Okay, and then let's look at the next question here, leaky bladder and perimenopausal flooding. Okay, so this person's using the term flooding, which is a technical term in Chinese medical gynecology. It basically means profuse or excessive bleeding. And when you use the term flooding or perimenopausal flooding, typically what they're referring to is abnormal uterine bleeding or dysfunctional uterine bleeding, known as bung lo. And actually, I think down here, Andrew Miles asked about this as well. When you hear dysfunctional uterine bleeding or abnormal uterine bleeding, what this means is it's a form of metrorrhagia, meaning that the patient is bleeding outside of the normal time that they're supposed to with regard to their menstrual cycle. So it's a pathological bleeding at an abnormal time as well. So the timing's off. And oftentimes it can be very heavy. It can come in a burst at irregular or unpredictable times, or it can consistently trickle. That's why the category is called flooding and leaking. You can also read spotting in there if you like. And so also leaky bladder. Okay, so the kidney's job, the kidney chi's job, is to secure and astringe or secure and restrain the essence in the body through the two lower yin, which you can read as the urethra and the anus. So it contains urine and it contains feces until the time is to open and release those substances. So typically, not always, but a leaky bladder is usually a kidney yin vacuity pattern. Flooding and leaking, again, this is nothing more than pathological bleeding. And so we know the three causes of pathological bleeding. You would want to look into those things. If you also see the kidney is weak, then you're going to need to treat that as well. So we don't need to necessarily get caught up ever in the Western terminology. That's what can mess us up. That's what can make us believe that Chinese medicine seems too simplistic, because how can 2 or 3 patterns treat the whole of medical gynecological complaints in Chinese medicine? Well, for the vast majority of the cases, it really isn't as complicated as it seems, because there's so many root patterns driving so many branch or tip symptoms. If you can get down to those roots, you'll take care of so much for your patients, independent of the variety of different Western disease diagnoses they have. Okay, everyone hearing me okay? Is that clear to everyone also? All of this making sense so far? I'm just going to wait a second to get a few answers to make sure. It's a little bit of a delay sometimes, but this looks good. Okay. Okay, I'm getting thumbs up. Thank you. Yeah, hit the little thumbs up. Okay, good. All right. Infertility or pregnancy-related concerns such as morning sickness and heartburn. Again, most of the time we're going to talk about infertility a little bit more in a second, or pregnancy-related concerns, but counterflow qi is really, really common. It's typically coming from the liver or from some stomach heat due to food, what's the word I'm looking for? The phrase I'm looking for, but indiscretionary food intake can cause some of these problems. And again, it's not something that we can get into or tackle at its root cause in this brief time, but pregnancy-related conditions are sort of a whole other animal and a whole other set. Obstetrics is a sort of a separate part of gynecology. It's not my particular area of expertise. I'm sort of on the front end by virtue of my job, but I can certainly get into that and will in other classes and in other talks. But counterflow qi is a very, very common presentation during pregnancy with regard to morning sickness and heartburn. Scott Fox from Australia, damp heat with phlegm causing blood stasis in the lower jiao? Totally, totally. He just basically presented beautiful Chinese medical disease patterns without necessarily spelling out exactly what symptoms he's treating, but yes, we do see that very often. Fibroids and cysts. How common, excuse me, I've got messages popping up here. How common are fibroids and cysts? Well, they're really common. And this is one of the things I like to talk about and harp on a lot, because the fibroid and the cyst in the traditional categories of Chinese medical gynecology fall under accumulations and gatherings, or concretions. Sorry, I did that backwards. Concretions and conglomerations, or accumulations and gatherings. They kind of push together into one category. And the key to these, and this is the most important thing, so you have to listen to me very carefully, because there are limitations to this type of traditional medicine. These, by definition, must be palpable from the outside. So not bimanually, where you have one hand that's inside and one hand that's outside and pushing, but rather manual palpation through abdominal palpation. You have to be able to feel these from the outside in order to make a diagnosis of concretions and conglomerations, or accumulations and gatherings. This is one of the things where in China even, they step outside of the traditional routes, and many doctors will in fact rely on the results of MRIs, CTs, ultrasounds, and to say, yeah, they do actually have these concretions and accumulations, and they are in fact blood stasis. People jump to that conclusion. There are a lot of people that think that way, and Bob Flaws once said this, and it always stuck with me. If you think that way, you would be in large company. There are many people that think that that's the right way to do this, but you would not be in good company. So take away from that what you will. I learned from Bob, so I'm a bit skewed on that, but I will say that to be responsible in your diagnosis, you have to have corroborating signs and symptoms within the traditional framework. And so these must be palpable from the outside. And then if they are, then you set about determining what may be causing this through further examination and through further inquiry. Is it blood stasis? Is there sharp fixed pain? Is it mobile? Is it round? Do they have jagged edges? All of those things will play into whether or not you're dealing with chi stagnation, phlegm accumulation, or phlegm nodulation, or blood stasis. It's important to make that distinction. Okay. Recurrent miscarriages. Really, really common, especially in Western patients. So recurrent miscarriages is one of these things that you will see in fertility clinics a lot. And that has to do with the fact that most of the patients that are coming in are already vacuous in some capacity or another. You see a lot of kidney, yang vacuity especially, in these patients that are failing to fall pregnant naturally that otherwise should be in terms of their age, constitution, and everything else. And then they get pumped up on the drugs for IVF. They do multiple transfers, and they either will implant and then the implant won't take, or there'll be failure to implant at all. And when you go and examine these patients, you realize that there's a severe vacuity at the root of all of this. And so the problem is they will artificially be pumped up. They'll get the positive test and then they'll lose the pregnancy. And then it'll happen again and they'll lose the pregnancy, and it'll happen again and they'll lose the pregnancy. All the while you as a practitioner are watching saying, yeah, we need to stop this process for the next like 3 to 6 months, begin to address this root vacuity pattern. Sometimes it's actually a dual pattern. You can have repletions via the liver depression pattern, but you can also simultaneously have kidney vacuous patterns as well. So looking at these things and helping to address the patients, the ones that get on board and give you that 3 to 6 months, and admittedly it is difficult to get Western patients to do that, but I have an advantage. I'm actually in a fertility clinic, so they're more likely to go along with what I'm suggesting. But for those of you outside of the fertility clinic, it can be a little bit more of a challenge. But those that do follow a pattern or a plan will end up getting pregnant much easier. Their pregnancy will go smoother. It will carry to term more often, and they'll have much less complication, and the babies hopefully are healthy throughout their lives as well. So I always tell my patients, listen, it's not just about you getting pregnant. It's about having a successful pregnancy, a healthy pregnancy, you being healthy, baby being healthy. If you can get through to your patients like that, they will typically respond and give you at least realistically, 1 to 3 months before they try again. Oftentimes that is enough. Okay, more on that later. Okay. Let's see, desire to be pregnant, and then aches and pains of pregnancy, nausea, anxiety, of course. So when women are pregnant, throughout pregnancy, one of the things that you're going to see a lot of is blood vacuity, because throughout the pregnancy, the heart is continuing to send blood down to the uterus to nourish. The kidneys are continuing to send essence to the uterus to nourish the growing baby. That leaves the heart relatively blood vacuous. It can leave the liver relatively blood vacuous. If the spleen is compromised through faulty diet in any way, not producing enough chi in blood, that's going to further aggravate liver depression and chi stagnation, because the liver requires blood to be emoliated and to be able to do its job of coursing and discharging. And so what you get, if you have blood vacuity, you can have blood failing to nourish the sinews and tendons, and that can create pain and discomfort, aches and pains. Liver depression, chi stagnation due to the inability of free coursing and discharge of liver chi can cause sort of floating aches and pains and things of that nature. So those are things to look out for in your pregnant patients. PCOS, I'm not going to get into right now, not because there's nothing to discuss, but because I'm actually going to shoot a video about this very soon. And also, this is one of those things, PCOS, because it doesn't exist in Chinese medicine, it requires a reframing into signs and symptoms that do fall into the traditional Chinese disease categories. We'll get into that in the video I'm about to shoot. IVF prep is another thing that I get a lot of questions about because of the nature of my work. I just touched on that briefly. When I meet with patients who want to do IVF, what I tell them based on my cursory examination, if I find problems in their physiology from a Chinese medical perspective, then I tell them, give me 1 to 3 cycles and let's see if we can work some of these things out before you do the IVF, before you do the transfer. Because suffering miscarriages, even if the embryo fails to implant, is devastating to patients. And I cannot emphasize what that does to their psychology. I see this all day, every day. You want to do everything you can to avoid the patient having to go through that. I promise you, if you can convince them to do 1 to 3 cycles, you're going to improve their chances. 1 to 3 cycles on Chinese herbs and acupuncture to give them the best chance. Okay. I know I'm going fast because I don't want to keep you guys for a really long time, so I'm just kind of spitballing a lot of information at you. It's going to be recorded so you can go back and check it out, and this will all get fleshed out heavily in any classes that I teach, but I just want to give you a sense of what to be on the lookout for. Okay, someone mentioned menstrual headaches. Menstrual headaches, I'm assuming they mean premenstrual headaches, sometimes menstrual headaches during menses, and then just after. These fall into the category of what's known as menstrual movement disorders or menstrual movement headaches. This has to do when the menses is moving down, either down or up between the heart and the uterus, and so that's what they call it, menstrual movement. But really what it is premenstrual typically. It's a sort of a reframing of Chinese trying to fit premenstrual syndrome into traditional categories. Headaches, again, we talked about this. When the heart sends blood down to the uterus, it can leave a relative blood vacuity, especially in the upper part of the body, which can lead to a headache. Also, because if the spleen is encumbered or it's being invaded by the liver, and so its function is being compromised in any way, we know that the defense chi issues from the middle. And if it's obstructed or if it's held down in any way, it can't protect the upper part of the body from exterior invasion. And oftentimes wind can lodge itself into those smaller network vessels in the neck, also causing premenstrual headaches. That's not that uncommon, actually. You can see that very often. Some people always get sick around their menstruation. This is a bit of an explanation into that mechanism. We go much deeper into that in any classes that I would teach. But again, it falls into that same category of tongzi bu tong bu tongzi tong. If there's pain, there's no free flow. If there's free flow, there is no pain. So just think about that anytime there's pain. What's obstructing the free flow of qi and blood? Okay. Again, migraine headaches just before periods. We talked about that. Andrew asked about qi vacuity, bunglo, which was when I talked before about bunglo, which was the flooding and leaking or dysfunctional uterine bleeding, abnormal uterine bleeding. Qi vacuity is commonly a culprit there. The question is, why is there qi vacuity? Why is there spleen qi vacuity? Why is there kidney qi vacuity? It's almost always the liver at the root. The liver, we'll get into this later, but the liver is the culprit. The liver causes most of the trouble for our poor female patients. We'll get into that in more detail at another time. PCOS and no periods after the pill. Okay, so after the pill, you'll see a lot of patients that decide they either don't want to do the pill anymore because they read an article that was really scary, or they're just tired of being on a birth control pill, or they're trying to get pregnant. They want to have a family. And typically what you're going to see is any number of a variety of patterns that may be causing amenorrhea, which in Chinese medical terms and gynecological terms is called blocked menstruation. Blocked menstruation in the context of birth control pills is typically a blood vacuity and a kidney vacuity. Those are what you usually see manifest. There are others that it could be, but those are things to be on the watch out for. Watch for blood vacuity and watch for kidney yin vacuity, kidney yang vacuity. If someone's been on birth control for a long time, they've gotten off birth control, and now they want to get pregnant, it may take a little bit of time for them to come back online, and they may be experiencing blocked menstruation, also known as amenorrhea. Okay. Endometriosis I spoke about in a video at length. You guys can check that out on the YouTube channel. PCOS, again, that was a question. Uterine bleeding, we talked about that a little bit. Irregular periods, okay, so irregular periods, irregularity refers mostly to the timing of the period. So there's menstruation ahead of schedule, there's menstruation behind schedule, there's early, late, no fixed schedule menstruation. Typically, the irregular menses is a form of bleeding when one is not supposed to, and that's what you have to look at. So the timing of menstruation has several different categories that you can look at in terms of pattern discrimination. So if periods are coming early, that would be abnormal bleeding. So if they're coming early, we want to look at liver depression, chi stagnation. We want to look at heat. We want to look at chi vacuity. If they're coming late, then we have to look at what would make a period late. Well, either there's not enough blood for the menstruation to descend from the heart, so there's not enough blood to cause menstruation, or there's something blocking the menstruation. So we look into things that may be, in fact, inhibiting the free flow of blood or the discharge of blood at the time of the menstrual cycle or the time of the menses. Okay. Menopausal issues, hot flashes, insomnia. I spoke about this in this little video that I shot, my tip on Friday about menopausal hot flashes in particular. In Western patients, it's amazing how often liver depression, chi stagnation is at the root of menopausal hot flashes. Can also be kidney invacuity. I don't want to rule that out, but make sure that you pay attention, especially for liver signs and symptoms as well, because that's often the one that if it's present and you treat that, that will be the thing that actually takes it out for them. Insomnia, again, relative yin and blood vacuity. As women age, they wind up with spleen vacuity and kidney vacuity, which of course can lead to blood vacuity, not nourishing the heart, and that can lead to things like insomnia, anxiety. I'm just seeing if there's any other questions that I haven't addressed here. We did painful periods, migraines, heavy periods. Yeah. Okay, so it looks like we actually covered almost all of the questions in more or less. So the key here, and don't run away just yet because we've got 1 minute left. Wow, that was actually amazing timing. Studying Chinese medical gynecology is a systematic study of Chinese medicine. It really is. Everything you need to know to be a top-notch Chinese medical gynecologist, you learned in your first year of school. I would argue maybe even in your first semester. If you can go back and you can know with absolute certainty the organs which engender qi, the organs which engender blood, the organs which control the blood, those in and of themselves, those three categories, if you know those absolutely cold, you will be able to solve just about any Chinese medical gynecology complaint that comes through your door. And that's because in women, the main thing is blood. And the relationship between qi and blood is intimate. So if you understand the inner workings of both of those substances in the body, how they're engendered, how they develop pathologies, you can take care of just about everything. Does that make sense to everybody? Is everybody clear about everything that I was talking about up until this point, all the questions that I was answering? Is there anything unclear about that? Because I can take a couple of questions since I'm here for another minute or two. I'll keep an eye out here. Everyone seems to be saying yes. Any thumbs up out there? Thumbs down, let me know. Okay. All right, good. It looks like everybody's fairly happy with what's going on here. So I think what we're going to do at this point is close for the day. And I'm going to do this again probably next week, maybe even the week after. I'll put this up, but what I'll do is post questions on the group of things that you may want addressed, and then we'll go from there. If you have any questions, you can always post them below this video too, and I'll try to get to them in the next couple of hours or even up until tomorrow. So thank you guys for coming out on a Sunday. I hope this is valuable to you. It's important for me to offer this to you because there's let's face it, the majority of patients that come to see us, at least in the United States, are going to be women of childbearing years. And if you really, really get good at treating gynecology, it's going to be awesome. Just remember the basics. Always remember the basics. You know that I hammer this until the end of time. If you know the basics, then you can be the expert, but you can't be an expert without the basics. It's critical. I know it seems boring, but if you do it, you're going to be the best practitioners out there. So I'll see you guys next week. Thank you so much for coming out. If you have questions, I will be happy to answer them. Take care.